Hello, friends. Welcome to The Way Home, Crossnore Communities for Children's Facebook Live show, as well as our podcast. My name is Holly Kessler, and I serve as the Senior Director of Community Relations for Crossnore. Every Tuesday afternoon, we're right here on Facebook Live talking with some of our staff members or community partners, and we enjoy talking about the work that we do, the child welfare system, different ways that we're engaging in our community. And so if you miss our live show, you can always rewatch it on our Facebook feed or our YouTube channel. And then the podcast comes out on Fridays on our blog at crossnore.org. So there are plenty of ways to watch each week and to engage with us. And we're super glad that you're here. Today, my guest is Meredith Martin. Meredith serves as the Vice President of Programs at Crossnore, and she is going to be talking about some myths around poverty and families that are involved in the child welfare system today. So please join me in welcoming Meredith to the show. Hi, friend.
Hi, Holly. Good to see you.
It's good to see you too. How are you today?
I'm doing well. How are you?
Doing just fine. Well, for folks who may not know who you are, although I feel like in North Carolina, everybody knows Meredith Martin, but maybe not everybody. Why don't you introduce yourself, tell us about your role at Crossnore and anything else that you want to share about your life.
Awesome. Well, it's great to be here and be with our Facebook and larger audience. I have been with Crossnore for about 7 years, and I have been in different roles over those years, and I'm excited to serve as the Vice President of Programs in this current role. I have a deep passion for underserved populations. I have worked in other organizations serving different types of underserved groups over my career, and just feel fortunate to be a part of the Crossnore team. I am also a parent in North Carolina. I'm parenting myself, and so it gives me some empathy for the parents that we work with professionally and supporting them and understanding how even with the many resources and supports that I have, things can be difficult. And so as we talk today a little bit about myths around poverty and child welfare, how that adds another element.
Yeah. Well, and you're a busy parent too, because you have twins.
Absolutely.
So you did not ease into parenting. You just jumped with both feet in, right?
Absolutely. I know, the deep end of the pool.
Exactly. Well, I can't believe it's been 7 years that you've been at Crossnore. That is amazing. So
I know, it's exciting.
Time flies when you're having fun, isn't it?
That's right.
Yeah. Well, since you've been here for 7 years, I'm sure that you are deeply versed in what our mission is. So share that with our audience, particularly for anybody who's new and doesn't know very much about Crossnore.
Absolutely. Yeah. So at Crossnore, our mission statement is to create healthy futures for children and families by providing a Christian sanctuary of hope and healing. And I am particularly passionate about this. I didn't share this a moment ago, but I'm an ordained deacon in the United Methodist Church, and I serve a part of my extension ministry through Crossnore. I'm also a licensed clinical social worker. So I really get to provide that overlap of my passions in this work. And Crossnore is really sitting at the pathways of social work and of living into our heritage as a Christian organization.
Absolutely. Well, we have a lot of programs, which you as the Vice President of Programs are intimately familiar with. So can you briefly describe programs that we have in place that help us to meet this mission? And then we'll hit on some of those as we talk about some of these myths too, as we go forward.
Absolutely. So Crossnore, particularly the Crossnore, North Carolina, or Avery County campus, is most known for our residential childcare, or we call it campus-based foster care program. We have several different cottages, many cottages, more than 10 different cottages on that campus and beyond. And I keep thinking about it because I know all of the nuances and details of the way things are changing up there. But that has been a place that started over 100 years ago, serving children, serving families in poverty. And we are continuing to do that in a new and an innovative way, still in our campus-based foster care program on both our Avery and Forsyth or Winston-Salem County campuses. So that is one of our core programs that we're most well known for over our 100 years of history. We also are well known for our foster care program, our community-based foster care. So that's what many people think of as foster care. So in North Carolina, the foster care system is built on volunteer foster parents. So people who decide that they feel called to use an extra room or even maybe an extra twin bed in one of their children's rooms as a place where they can serve a child who's in need of foster care. And so we have many families throughout the state who serve in that way, and we support them as their licensing agency. We, of course, have other outpatient programs throughout our service array. We have a outpatient therapy program that is offered throughout our Western North Carolina services. We have some intensive in-home, or we also have a home builders program. So those are programs that go in to families' homes and really try to remove the risk from the home as opposed to removing the child from the home. And so we're excited about the expansion in that area. And then we have several other programs like tailored care management that, again, try to support families in maintaining safety in their homes. And our newest program that we're really excited about, and then I will talk more about today, is called Bridging Families. And that really gets to weave together some of the best parts of all of our programs to serve families and children and help them stay together or reunify if they are separated because of the foster care system.
So really, as I've listened to you talk, I've actually thought about our continuum of care image, and
Absolutely.
we'll put that in the show notes on our website so folks can see that. But I think the thing that has been the most exciting in our programs over the last few years, you talked about how we were so well known for residential and even community-based foster care, but we've really expanded to programs that are supporting families kind of all along this continuum, both before children are removed from their home to actual foster care when the children need a dependable home to live in. And then, of course, we have our youth independent living that supports young adults as they age out of foster care. And then some of those other things you talked about, family preservation and therapy services, are also needed services, but help support families as well. So we have this whole continuum of care that we can offer.
Absolutely. Absolutely.
Yeah. Well, one of the common myths about children in foster care is that they have all been rescued from some type of horrific kind of abuse. And I wondered what you thought about that. Is that really true for all of the children that we see in foster care? And are there other reasons that children might be removed from their homes?
Yeah, thanks for that question. I think that's something that before I got into this field, I maybe had some stigma or assumptions around. I think that a lot of people have that. And I think it's just kind of you know better, and then you can react to that as a community citizen. So as you talked about our continuum of care, really we try to support children and families all along that continuum of care. And they have differing needs and differing challenges in their families, but really all of them center around child safety and welfare due to some family crisis. That's usually at the root of everything that we do with families. And sometimes our goal would be to intervene early in that crisis. But as most of us can relate to, when you neglect a crisis in your family, usually things get out of control. So sometimes when you live in poverty, you have less resources to react to that crisis, but that's not always the case. You talked about myths around why children come into foster care. So a lot of, most of the times when a DSS worker goes out to a home, they are not taking a child immediately into foster care. Actually, that's kind of less likely of what happens. And what we also know is that across the country, and it's true in North Carolina, that the majority of children in foster care in North Carolina come in because of neglect, not because of abuse.
Okay.
So when I say neglect, what I mean is leaving your kid alone for extended periods of time when they're too young for that to be an appropriate thing to do, or not providing them adequate food or adequate nutrition, or unsafe living environments, or not getting them medical care, which may include mental health services. Sometimes not taking them to school is also a form of neglect. And so that is the primary reason that children are brought into care. But there's many other reasons, of course. So, of course, abuse, which is horrific. And we certainly would want to try to put services in to take the opportunity for abuse to happen away. And so that is another reason. It's not necessarily the primary reason. Right. Another thing that is very, very prevalent in North Carolina and across the country is something that interacts with neglect, which is parents who are users of different substances. So I'm sure most people have heard of the opioid epidemic, but even all kinds of drugs and alcohol are reasons that parents are unable to provide adequate care for their children. And so we see that as something that really interweaves with neglect. I think another thing that is important to mention is that the majority of these situations are not real clear cut and cut and dry. Right. And so there may be myriad of things going on. In addition to what I already mentioned, if there are no other family members, kids may come into care because their parents are incarcerated or because they're have an illness and they're unable to take care of them. Of course, and this is not as common as it used to be kind of in the beginning of the heritage of our organization, but when there's a true orphan, so that would be someone who has no parents who's living anymore, that'd be a reason why they would come into care if they have no other grandparents, aunts, uncles, people who can step in the gap there. So those are really the majority of the reasons why we see kids coming into foster care.
Well, I appreciate that explanation, because I do think that a lot of people do just assume that kids that have been in foster care have been abused in some way. And while some of them have, as you've highlighted, there are lots of reasons that families find themselves in this situation. And the most interesting one I thought that you were talking about is around neglect and sort of the different ways that neglect can be characterized. And I wondered, how sometimes do we sort of interpret neglect through this lens of poverty? You talked about leaving children alone when they're too young to do that, or other types of neglect. But for a family that's experiencing poverty, there are lots of other forces, kind of coming to bear on those situations. So how does that sort of help us interpret, or maybe not help us, maybe helps us interpret it wrongly in this idea of neglect?
Yeah, thanks for that question. I think it is important that we name some of these assumptions and stigmas we have about why people are coming into care and what it looks like. So one thing that came to mind when you were talking about this for me is that just because a family is poor or low income does not mean that they're neglecting their kid.
Right.
And conversely, just because someone is rich or has means does not necessarily mean they aren't neglecting their kid. So, I think there are families who maybe are emotionally neglecting their children. They may make $1 million a year, but they're not attending to those attachment needs of a child. There's, of course, a ton of systemic reasons why people in poverty and people of color are reported to Child Protective Services at higher rates than families of means. And we can definitely unpack some of that. Of course, we won't be able to get into all of those many systemic reasons today. But I was looking at the NC Child's 2023 child health report card. And just to kind of give us some numbers based on their data, so 40% of children in North Carolina live in poor or low income households. And that's less than 2,000% of the federal poverty level, which for a family of 3 is under $25,000 a year of income. So there's 3 people living on less than $25,000. 40% of kids live in households like that in North Carolina. But only 4.5% of children in North Carolina are assessed for child abuse or neglect. So, and I'm sure out of that 4.5%, it's not necessarily all children in low-income households. So I think it's just kind of, there are a lot of families who do not have a lot of financial means, who do an incredible job of raising their children, who take care of them, who meet their needs in so many ways, who advocate for them, who love them, who provide for them. And I remember when I was an intern at at DSS when I was going through my social work degree, that we had a really great worker that took us out on initial investigations. And there were families that were either homeless, living in cars, maybe we were in a rural area and they were washing their clothes in a river. And I remember the social worker telling all of us interns that we need to realize that this is a completely adequate way to take care of your child. And just because they may not be how we grew up doesn't mean that families aren't being taken care of. And so it is important for us to check ourselves and our biases and realize that does not necessarily mean neglect.
Yeah, that is a great point, Meredith. And I'm glad to hear that there is sort of a kind of a definition of what that neglect looks like, so that for someone who's investigating these cases, it doesn't have to do with how much money you have or don't have. It doesn't have to do with a subjective sort of viewpoint of, well, I wouldn't raise my kids that way, or that's not the way I would raise children. That there's a myriad of ways to adequately care for and raise your children, and they don't all have to look the same. And one's not better than the other, and one doesn't necessarily constitute neglect where another one doesn't.
Absolutely. And I think another thing that a lot of folks don't know that is important to know when you think about child welfare in North Carolina is that there are, like, as you've mentioned, general statutes or laws that define child abuse, neglect, dependency, and kind of all the things that we talk about. And you can certainly Google general statutes around this and read them. But they're implemented by 100 different counties. And so the way it's implemented in Mecklenburg County or in Forsyth County is probably very different than how it's implemented in Surrey County or Cherokee County or Swain County. And that each county has that unique culture of their county, and hopefully they're implementing these general statutes in a way that's appropriate.
Yeah. Well, what does this whole discussion kind of mean for how we view parents who are experiencing poverty and whose children are in foster care?
Absolutely. So as I mentioned, there's so many just systemic reasons why people find themselves in poverty, of course, and then also why they find themselves involved in the child welfare system. So, of course, generational wealth is something that is hard. You know, we have certain groups, primarily white groups, who have more assets, and we have other groups in our country who don't have as many assets, people of color, female-led households. And so, it's important for us to acknowledge, like, the forces of racism, the forces of sexism in our country do contribute to the way this system plays out. And so it can be overwhelming to think about how we either participate and we don't realize it in a system that can be hurtful to families and to ourselves, perhaps. But also, I guess, as I've worked at Crossnore and as we have gotten involved in public policy, to think about ways that we are the people that we have been waiting for to help change this system. And we may not have that system fully changed in our careers, but how do we contribute to systems change so that more families are not ripped apart by systems that are intended to try to help them, but unfortunately don't always do that.
Yeah, that is a great reminder. And I think it's important for us to think about families whose children are in foster care, are involved in the child welfare system, and think about what sort of resources are available to them. And so how are we working at Crossnore to provide resources for families that maybe help facilitate their reunification or help them to deal with, as you mentioned, some of maybe the family crisis that landed them in this situation, maybe the generational trauma that they've experienced throughout generations in their families. What are we doing to help provide resources?
Absolutely. Thank you for that question. So this is really where Bridging Families is a innovative program in in child welfare, both in North Carolina and across the state. So what Bridging Families is, for those who aren't familiar, is essentially we're trying to take the best elements of all of our programs and package them in a way that help families reunify who are in foster care. So we are having professional foster parents whose full-time job is being a foster parent. Majority of foster parents, if not all of them, until we started this program, in North Carolina, they have to have a full-time job outside of the home and then take care of children who have high needs. So we have full-time foster parents. We have a case manager who helps kind of coordinate all of the logistics of a case. We have a therapist who is trained in evidence-based models that helps provide individual, family, and systems therapy for everyone involved. And then we have a team of supervisors who can support our caregivers in our team. And all of those folks work together with a biological family. The children live in the foster home, and the biological parents participate as much as they're able to. Of course, we partner with Department of Social Services, their guardians ad litem, et cetera. But our goal is to really flip the script on how child welfare is done. A lot of times parents might have 2 hours a week of visitation at a DSS office. And so what we believe is that the more connection that children and parents have earlier and quicker as they're involved in the child welfare system, the more likely they're able to address the crises that landed them in this situation as much as possible, and they're able to reunify. So we have staff who want to try to work to take away those barriers. So, for example, is an unpaid court bill a barrier? Is having transportation a barrier? Is not knowing how to do a resume and get a job a barrier? Is living with family members who are still struggling with active substance use a barrier? We want to have our team come around and be professional supports in addition to the natural supports in this family's life to help them overcome the challenges they're facing so that they can be successful in being together. Because our belief is that the children are best in their family of origin. And we want to help take anything away that is getting in the way of that goal.
I love how you describe that as we're providing those resources, but the goal is to remove barriers that are keeping those children in and out of home placement so that they can go back home.
Absolutely. Absolutely. Yeah. And I think we're teaching our staff and our biological parents some common sense parenting techniques. We're using trust-based relational intervention, which is our kind of parenting curriculum, and everyone in the entire team is trained in that model. And we really want to bring everyone together on a common understanding of how to support kids best. And so it's really exciting. It's cutting edge work. We're getting inquiries from across the state and across the nation on what we're doing. And we really hope to be a part of that systems change that I was talking about earlier.
Yeah, because I think you tell me, is it fair to say this is something that I've heard kind of anecdotally, and I don't work directly with the families, but I've been told that some of the families we're working with in Bridging Families have said things like, nobody ever taught me how to do this, or I didn't know about this resource, or, so some of it is just around education and mentoring and coaching in some of these situations.
Absolutely. I think that some of us who've had access to privilege assume that everyone has had the same resources that we've had, and that's just not the case. And so we have to be mindful of kind of starting at a very basic level and building on that. And of course, our parents are just children who've grown up, just like all of us. So they have experienced oftentimes generational trauma, as you mentioned earlier. They had parents who maybe didn't always model appropriate ways to connect with one another. And so we really want to meet them where they are, not shame them, not make them feel badly, but say, hey, you can do this. Your kids love you, you love your kids, and we're going to believe in you. And I think sometimes that's what people need, is someone to believe in them and trust that they can do it and hold them accountable. And that really is, it's not easy. A lot of the reasons why kids end up in foster care is still something that we deal with on a daily basis, whether it's substance use, whether it's history of domestic violence. There's a lot of things that are going on in these families, but we want to say, you can do this, and we're going to support you along the way.
Yeah. And to sort of tie it back to kind of where we started, a lot of those things that you mentioned happen in families regardless of their socioeconomic status.
Correct.
Um,
Absolutely.
So it is not just about poverty for sure. Well, are we hiring in the Bridging Families program, and how can folks find out more?
Absolutely. We are definitely hiring. Folks can look at crossnore.org and our careers page. You'll see a lot of postings that have Bridging Families in the name, whether it's for a case manager, a supervisor, our director. We're still in an active search. We are looking for folks, including bridge parents, folks who feel called to full-time parent people's children and coach other biological parents. Really ideal candidates for bridge parents are folks who've parented themselves and maybe are kind of past that time for their own lives and their own families, but they feel called and they feel like they have the skills to help others learn those skills and really come alongside them and support them. So the reason you see so many Bridging Families postings is because this program is expanding faster than we even could have anticipated.
Absolutely.
And we're really excited about that.
Yeah.
And we look forward to seeing where we're going to be in 1, 2, 5, 10 years with Bridging Families.
It will be interesting to see. And like you said, it's growing so quickly. So we do need some additional hires for sure. Well, Meredith, thank you so much for all that you have talked about today and have helped to educate us on. And thank you for all the work that you do at Crossnore. It was great to have you be a part of our show today.
Thanks, Holly, and thanks to everyone who's listening. We look forward to connecting with you.
Absolutely. Well, friends, as I have thanked Meredith for being here with us today, let me also say thanks to each of you who are watching or listening. We so appreciate the opportunity to tell you about Crossnore. And for more information, please visit our website at crossnore.org or follow us on our social media channels on Facebook, Instagram, and LinkedIn. That's it for today, but I hope you'll join us again right here next week on The Way Home.